What do you got here?
Mr. Jim Joyce, who has been a friend, a former neighbor. That's how much of a friend he has been to.
Is that before you were evicted, or was it
Yeah,
because
exactly.
the Funyun dust?
He had us kicked out of the neighborhood.
Jim was the one that called the cops.
Yeah.
CEO.
That's the email I got. Hey, got to talk to you about your partner on the air there, big fella.
CEO of Siegen Therapeutics, Incorporated, their ticker symbol, of course, SIGY. He is also an inventor and a former Denver Bronco.
Are you really? You played for the Broncos?
Sure did.
No kidding.
One of the best to ever come out of the University of Maryland. I'm done blowing sunshine.
Wow.
Thank you.
Well, as a Raider fan, I can't believe you even mentioned it.
I know.
Well, once he found out I was a Raider fan, we kind of
That's when you moved out?
Yeah, a little bit.
So Mike lived across the street from us.
Yeah.
And during the pandemic, I welcomed him to the world headquarters of Siegen Therapeutics.
What's your garage?
We started. It was, and it was
back
it
bedroom?
was a plastic Costco table. I'd open up the garage, and people
Jeff
walk
Bezos.
by, and I'd be
Jeff
like,
Bezos.
"Welcome to the world headquarters of Siegen
Jeff
Therapeutics."
Bezos with a
that
dot
really when it
matrix
started?
printer.
It is.
Yeah, that's right.
I would go down.
right?
I would go down our street with our leaf blower, and they'd look, and there's Jim at Siegen
Trying to cut a
headquarters.
deal, and you're out there, perfect time.
Now look at him now on the Big Biz Show.
Biopharma has taken quite a journey in the last few years. 2022, 2023, really hard for biopharma companies. JP Morgan comes back last year at the beginning of 2024 and says, this is the year, but you're not going to raise money the first quarter. Sure enough, you could raise money the second quarter last year, and then the whole thing, once again, started waning again and had a really tough 2024. It seems as though capital markets are open for biotech, biopharma. Seems like things are looking good now. It seems like you went through the worst of it.
Starting to open up, but if you're an investor in small cap or micro cap, you better know your CEO well.
Yeah. Well, listen, but I'm talking about as a group, I think you're at the right place at the right time now. You come to me in the middle of 2023, I'm thinking, man, you were swimming through cement. Everyone was in your industry, don't you think?
No, that's very much the case. But I think there's a transition in our industry as it relates to therapeutics, against emerging infectious disease disorders or sepsis or things of that nature, where there's a trend that, trend towards medical technologies, blood purification technologies.
Well, and I think that's, and you're the new frontier here, hence the word sepsis that we've heard about. And I have an aunt that is going through that right, like as we speak, as we're interviewing you here. Talk about the problem, talk about the solution, talk about this new industry that's emerging that you guys even announced in a press release a few days ago.
Yeah, it's an emerging new industry, like 20 years in the making.
Yeah, that's how it always works, though, right?
Yeah, that's how it works.
We just found out about today, so it started today.
Yeah. So sepsis, this is a dysregulated immune response to infection. So it's the transition. If somebody's suffering from a life-threatening viral infection like COVID-19, when it becomes a severe infection, it transitions into sepsis. Sepsis in general, #1 killer in U.S. hospitals, 1 in 3 deaths.
Because it's antibiotic resistant, is it not?
In many cases, yes, but something that's fascinating about sepsis in general, and this was learned, as devastating as COVID was, sometimes we learn things that really weren't known before. But there was a study of individuals that was severe COVID infection at George Washington University Hospital. And they enrolled 96 individuals in this study. And they quantified that these individuals, 95 of 96, had circulating bacterial toxin called endotoxin. And this
circulating back, that means it's circulating. That means it's not here anymore, it's over here now.
It's in the bloodstream.
Oh, man.
But it's one of those riddle me this moments because only 3 of the 95 people diagnosed to have circulating bacterial toxins actually had a bacterial infection. So one of the things we learned with COVID is that when you have an infectious response, the immune system responds, it produces pro-inflammatory cytokines. The overproduction of pro-inflammatory cytokines, called the cytokine storm, and a lot of people heard about that phenomenon with COVID. But what they didn't recognize is that inflammatory process creates permeability in the intestinal wall, and it leaks out your natural bacterial, and this is the potent activator of sepsis. And we didn't know this. I was involved in a DARPA program for 5 years to develop devices to treat sepsis for wounded warfighters. We didn't have any idea that this was an important component of sepsis. So now we know dampen down pro-inflammatory cytokines, address the pathogen source of inflammation, but also address these bacterial toxins.
So what is Segan doing? Is Segan have do we have a pathway here for a treatment? Do we have a candidate? Are we on the way there? Or
Yeah, we're getting ready to head into human studies. We've done.
Boy, that's big.
Yeah, since Mike, I waved to him in the morning. Going by the world headquarters.
I was the catalyst, by the way.
We conducted a whole series of studies at University of Michigan that demonstrate the ability to address these bacterial toxins, broad spectrum viral clearance, as well as being able to dampen down excessive, inflammatory cytokine production. Then we moved into animal studies, and now we're getting ready to submit what's called an investigational device exemption to FDA to initiate studies to address this endotoxemia and.
Can I make the assumption that since, as you mentioned in the beginning, that it's the leading cause of hospital mortality is sepsis, that your addressable market is endless for something like this?
It's large, but we also have a strategy from a clinical standpoint. We have an early clinical and commercialization strategy to start off in dialysis patients. These are end-stage renal disease patients who are being treated 3 times a week, 4 hours of treatment. These individuals suffer from endotoxemia that's created by the inflammatory response to the regular dialysis, and it shortens their life. Average lifespan once they're on dialysis is 5 years. It's the same markers we're looking at in sepsis, but in this indication, we don't have to wait for anybody to come into the ICU. No. They're already in the seat.
Greg, this is good news. You said we were going to be scared. I think this is good news.
Well,
I feel good about what I'm hearing here.
There's part 2.
Completely different book that I was referring to.
Jim Joyce is the CEO of Segan Therapeutics. Their ticker symbol is SIGY. Jim, to the point that Greg talked about, the next big pandemic or what's going on over in the Congo.
Now, what's it going to be? What's the next cootie going to be?
Yeah. I don't know. There's all kinds of stuff floating around.
Oh, great. Here's chapter 2.
Here it is.
Chapter 2 is among us.
I'm going to get my mask. I'll be right back.
It used to be like, okay, bird flu of 2009, and that'd be a concern for a few years, and then there'd be the next thing, Zika pop up or whatever it might be. But now everything's just like looming at the same time. And the ability to monitor these diseases is getting more and more challenging.
Stay here. You're not going anywhere. This is like the mob. We're keeping you here.
We want to make Greg cry.
Yeah.
So chapter 2's here, and Greg's not going to be part of the show until next week. Mary's out there buying masks. So it's just me, Mike, and Jim.
All right, Jim Joyce, CEO of Segan Therapeutics. Much more to come. We hope the news is better as the Big Biz Show rolls on. Keep it here.